We have a quality of life second to none. We relish the pace, the fresh air, and the natural beauty, and the caring communities that we've built. Health is at the heart of this special quality of life. Our health and health of our loved ones is what we cherish more than anything. When we are the picture of health, it's easy to take for granted, but we also know things can change in a minute.
It was absolutely out of the blue for me. I experienced a really powerful headache, like the worst headache I've ever had in my life. Like it was, and I guess I was pacing around the room, holding my head, and and then I think I blacked out at one point.
You did.
39-year-old Chris McMahon and his family had only used the Almonte Hospital once since moving to the area 5 years ago, before being rushed to the ER that incredibly scary Saturday in June of 2020.
I was scared. I was really scared. And then the nurse, when she told me that they're gonna have to send him for imaging because they didn't know, and it was really peculiar because he's a young guy and he's fit and healthy, and they were very confused of what could this be.
Doctors desperately needed a CT scan of Chris's brain in order to determine the right course of action. Almonte General Hospital doesn't have a CT, but this vital diagnostic tool has been identified as a major priority for foundation funding.
CAT scan, or CT scanning, has become a standard of care for hospitals across Ontario and indeed across Canada. It's an important tool that physicians can use to help diagnose conditions that patients have, which then leads them to make quicker decisions related to treating whatever the condition is that patient happens to have. So it's an important thing for us to be able to add to our hospital here in Almonte, not just for the people who are directly served by Almonte General Hospital, but also for our neighbors in communities like Carleton Place and Arnprior, where they also don't have CT scanning available at this time.
Because I did have to travel from here to Ottawa, and if time was a factor, which in this case it could have been, I came through it okay. I feel 100% now, but I feel like it could have went the other way with that time there. If been able to do CT imaging and then like, oh my gosh, he has a ruptured aneurysm, okay, he needs this medicine, then send him off.
Many of our inter-hospital transfers are for CAT scans to give us more information. So someone in trauma patient, they have head injury, we can't, with confidence, make the diagnosis in the emergency room now, so we have to ship them out, usually to Ottawa or to Smiths Falls, for a CAT scan to give us that information. So that would be eliminated. So that would improve care, and it would improve the timeliness of care.
Well, I was diagnosed, I got about 4 months ago now, with interstitial pneumonitis, which is a chronic lung disease. And I will need CT scans every 6 months for future treatments, which means going into the city of Ottawa, it's a 12 plus month wait to get into the CT scans there, or I could possibly drive up the valley to Renfrew, Pembroke, or possibly Smith Falls. So the thought of having to make these long drives is not very, we're not looking forward to that part.
Having a CT changes the game on multiple levels as far as I'm concerned. I think a huge part of patient care is in giving my patients peace of mind. There's nothing worse than being in limbo as a patient and not quite knowing. And it will surprise you how much it would change a patient's experience to know sooner. That trip to an Ottawa hospital, still not really knowing what's going on, is a hard one. It's a really hard trip.
Many people are often surprised to learn that the hospital and Manor also counts on the community that it serves to provide critical support as well.
We think of, in this province, we think of healthcare being funded, and it is not fully funded. The equipment that's in our hospital today has been purchased by the community. So and through the foundation. So when you become involved, you learn that need is there, that we all really need to contribute.
Simply, if we want to continue to attract young emergency medicine doctors, they will have trained with a CAT scan, and they will want that clinical certainty. Getting rapid access to those scans here in our own community, that would be terrific, and that's going to make our hospital, like the hospital stay, shorter almost certainly. It's going to make treatments more efficient and more targeted and more appropriate and better.
To find out more about supporting the $2 million Picture of Health campaign to bring CT to Almonte General Hospital and helping at the Almonte General Hospital or Fairview Manor, please visit almontehospitalfoundation.com.